Thank you, General.
Senator Heinrich.
Thank you, Chair. Attorney General, as you know, Vice Chair Collins and I worked very hard on a number of provisions in the Bipartisan Safer Communities Act with respect to both straw purchasing of firearms and then also gun trafficking offenses. Can you give us an update about how the department is using those new offenses and what progress you're making on that front?
Yes, I'd be happy to. So that act is really the most important gun legislation in decades, and it has already had significant impact on our ability to prevent guns from falling in the hands of people who are prohibited by Congress from obtaining them because of their dangerousness. So as a consequence of the act, which extended the background checks for people under 21, we have been able to run 245,000 enhanced background checks, and we have denied 700 transactions which otherwise would have gone through, 700 people who should not have guns because Congress has so declared. And with respect to the straw purchasers provisions, we have charged more than 420 defendants now with illegal straw purchases under provisions of the BISCA and associated statutes we have on straw purchasing. So I'd say it's early days, but
yep.
It's been very effective.
Yeah, we definitely want you to be able to use those authorities. What about the gun trafficking authority? Has that been helpful as well?
Yes, the gun trafficking allows us a separate crime and a separate penalty for trafficking guns where it's known that the guns are going to be used in crime, and those have also led to successful prosecutions.
I want to turn to fentanyl, and obviously that's something that's on everyone's mind on this panel. One of the things that I worked very hard on in the recent 24 CJS bill is language to create a comprehensive fentanyl tracking system. Can you tell us what you intend to do? I know we got that legislation done a little late, as Senator Moran reminded us, but we want you to be able to use those authorities and tell us about how you plan to put that together.
Well, so DEA will be using that to track the way in which fentanyl is prescribed and used, and that will be very important in our enforcement efforts.
Are you able to coordinate your efforts with DHS to help interdict fentanyl when it comes through land ports of entry before it gets to the U.S.?
So the FBI and DEA do have overseas intelligence which they're able to provide to DHS. I will say this also comes from our intelligence community writ large, and not simply the two agencies here. It is definitely the case that the more intelligence we can get and the more cooperation we can get from the Mexicans as to their information about fentanyl being moved to the border, the better DHS will be able to interdict it at the border.
How can Congress help you leverage better cooperation from both Mexico and China on this front?
Well, I'm not a diplomat, so on that phase, I'm not sure what Congress can do in this regard, but we are making every effort possible. The DEA administrator has spoken to her counterpart in China. The president, as you know, tried to re-up the cooperation that had been suspended with respect to drug trafficking. So at a law enforcement level, we are trying to enhance that. On the Mexico side, as I said, the president has directed members of the National Security Council staff to travel to Mexico. I've traveled, the Deputy Attorney General has traveled to try to enhance cooperation and get improvement in it.
We very much appreciate those efforts. I want to ask you about something related to treatment for folks who know they have addiction to fentanyl and other opioids. Yeah. Can you talk about what DOJ and DEA are doing to increase access to treatments like buprenorphine for patients in need? And this has been a particular challenge in New Mexico, where people want to get treatment, but they can't always get their prescription filled to get off of their fentanyl addiction. And I'm curious if you think it's necessary to remove medications like buprenorphine from the suspicious order reporting systems, because that seems to be the thing that is hanging up these prescriptions for people who are very much wanting to get treatment.
Well, to begin, this mostly comes from our grant programs, from the Office of Justice programs. We have the so-called CARA grants, which is the Comprehensive Addiction and Recovery Act. We're asking in this budget for $443 million, which is a $23 million increase. Those grants include our Comprehensive Opioid Stimulant and Substance Abuse Program, the so-called COSAP program, mental health and residential substance use treatment, the drug courts, the veteran treatments courts, prescription drug monitoring. We also have particularly youth-focused grants, some seeking $47 million there for opioid-affected youth. I'm not exactly sure that I have the information with respect to Butte and how it's being treated in that respect, so I'll have to get back to you on whether...
Yeah, I look forward to following up with you on that, because I think we need to send a clear message to the pharmacies that they should stock the medications necessary for treatment. Thank you, Chair.
Thank you, Senator Heinrich. Senator Collins.
Thank you, Madam Chair. Welcome, Mr. Attorney General. I very much appreciated